Welcome to anatomy class. I'm joined here by my student Bianca. I'm Professor Sharp, and here today we have Elmo in anatomical position. We're going to learn the basic directions of the body. Bianca, could you please tell me what the right and left of the patient are?
Well, the right is the patient's right, not the examiner's right, and the left is the left of the patient and not the examiner.
Perfect textbook definition. Alright, let's move on. Welcome back to anatomy. Now we have placed some directional terms on Elmo, and I'm going to tell them to you. Inferior refers to being away from the head, while superior means it's towards the head. Here you have anterior, which means it's closer to the front of the body, and posterior means it's closer to the back of the body. Bianca, could you please give us some examples?
Well, the eyes are superior to the nose, and the toes are inferior to the knees. An example of posterior and anterior is the stomach is anterior to the spine, while the kidneys are posterior to the small intestines.
Very good. Hello, welcome back to anatomy class. We're going to continue with our directional terms. I have drawn here on the board a medial line. It's basically, if you could draw an imaginary line down the center of your body, that would be medial. And an example of medial would be, say, the tongue is medial to the ears. Opposite of that would be lateral. So if I drew away, like towards the outside of the body, and the thumb here would be lateral to your belly button, because that's on your midline. Would you like to go over distal and proximal?
Yep. So proximal and distal refer only to the arms and legs. So proximal means towards the origin of the body part. So the wrist would be proximal to the fingers, and then opposite of that, distal would be like away from the origin of the body part. So an example of that is the elbow is distal to the shoulder.
Very good. Now we're going to go over superficial and deep. So superficial refers to closer to the surface. So Bianca's skin would be superficial to her muscle. The opposite of that would be deep. So Bianca's heart would be deep to her ribs because deep is away from the surface or underneath. Okay, now we're going to move on to the skeleton of the body. Axial skeleton would refer to the head, the neck, and the trunk, which is basically just your cranial and your vertebral cavity, and that's your axial skeleton. Your appendicular skeleton would be all the limbs or appendages that stick out of your axial skeleton. So that would include both your arms and your legs.
Next, we have.
Okay, as I mentioned before, the cranial and vertebral cavity. The cranial cavity refers to your skull. It encases the brain and protects it. Your vertebral cavity is the cavity that protects the spinal cord. And this is all a part of the dorsal body cavity, which is protecting the nervous system as a whole. So your cranial and vertebral cavity are subdivisions of your dorsal body. Next we have the ventral body cavity. And Bianca, would you like to tell us what cavities are part of that?
Well, the ventral cavity contains the internal organs, or the visceras, so the other big cavity is the ventral body cavity, which contains the internal organs, or which is also called the viscera. It has two subdivisions. The first one is the thoracic cavity, which contains the heart and the lungs. And then we have the abdominopelvic
Abdominal pelvic.
cavity, which contains all the abdominal organs around this area right here.
The abdominal pelvic and the thoracic cavity make up the ventral body cavity as a whole. Hello and welcome to day 2 of anatomy class. I have Bianca here with me again, and we're going to go over the planes of the ways to cut the body. Bianca, can you demonstrate?
Well, a sagittal plane is a cut that divides the body from a left and a right. So it'd be like that.
Yes. So as Bianca says, it's a cut that divides the body into a right and left part. Okay.
Then there's mid-sagittal, which is like a sagittal, but it's a cut along the midline. So the cut would go right about here.
Yep. So equal left and right parts.
Then there's the frontal plane, which divides the body into a posterior and anterior sides. So the cut would go like this.
Yes. So a back and a front. Very good.
Transverse plane is a cut that divides the body in a superior side and an inferior side. So the cut would go like this.
Yep. So a top and a bottom. And those are the planes. Okay. Here we are going to label the regions of the abdominal pelvic cavity. Here we have the right hypochondriac region, which means pertaining to below the cartilage on the patient's right side. Next is epigastric, which is above the stomach. Then we have left hypochondriac, which means pertaining to below the cartilage on the patient's left side. Let's see. In the next region, we have the right lumbar, which is the patient's right over the lumbar muscles. And we have the left lumbar, which is the same on the patient's left side. In the middle of those two, we have the umbilical region, which is basically your belly button. And we have the right iliac, which is the last row. It's your hip area on the patient's right. The same thing goes for the left side of the patient. And finally, we have hypogastric, which is below the stomach. And those are the regions. Okay, now we have the quadrants of the body. Basically, what these would be used for is in an emergency when you need a faster way to refer to areas of the cavity. So instead of using your regions, you would use your quadrants. Bianca, could you please tell us which quadrants are which?
Well, this area over here is the right upper quadrant, which is the upper right of the abdominal cavity. Below that is the right lower quadrant, and that's the lower right of the abdominal cavity. Over here we have, in this area, the left upper quadrant, which is the upper left of the abdominal cavity, while below here is the left lower quadrant, which is the lower left of the abdominal cavity.
Very good. And that's all of our anatomy lesson, so thank you for watching, and I hope we taught you something useful.